In 1941, a Red Cross flag flying in the air witnessed the birth of the military hospital of the new 4th Army, the present Nanfang Hospital, in the native land of Subei, the northern Jiangsu province. Since then, the hospital has moved from the south to the north of China, across 2 centuries, achieving magnificent glory. During 70 years of storms and gunfires, Nanfang Hospital has moved its base 4 times, changed its affiliations 5 times, updated its name 10 times, and twice experienced the transition from an army hospital to a civilian hospital. Through 70 years of typhoons and battles, Nanfang Hospital has grown from weak to strong, and from better to best. Singing the triumphant songs during the victorious march, Nanfang Hospital has advanced to become a shining star in the sky of the Chinese medical world. Ever since the transition from a military hospital to a civilian one in August 2004, Nanfang Hospital has turned its glorious historical past into an eminent present, in which the faculty, under vigorous and innovative leadership, works together to perform the melody. The prestigious Nanfang Hospital is located on Qiling Hill, at the foot of picturesque Baiyun Mountain in Guangzhou. Over 70 years, Nanfang Hospital has not only formed a comprehensive system in medical discipline, but also constructive distinctiveness in medical service by adopting a strategy of promoting comprehensiveness and individuality. Ever since its transition to a civilian hospital under the Guangdong Provincial Administration, the hospital has set up prominent subject groups of gastroenterology, orthopedics, and nephrology, and constructed a multidiscipline platform based on hepatology, nephrology, and oncology. Nanfang Hospital is home to 54 medical departments, owning 1 state-level key subject, 1 national key discipline, 9 national key clinical specialisms, 5 provincial key clinical specialisms, and 4 provincial key disciplines. 96% of the clinical departments are entitled to confer the degree of medical doctor. Nanfang Hospital is proud of its brilliant experts and renowned doctors. For the past 70 years, the hospital has been attaching the greatest importance to the construction of talent teams, constructing the environment in which the top talents can bring their brilliance into full play. Academic leaders can steer their teams, the technical teams can cooperate in clinical and scientific research, the introduced talent teams can promote clinical and scientific research, and the international joint teams can exert their leadership academically. The construction of talent teams has promoted full-scale elevation of core competitiveness. For the past 70 years, the hospital has constructed complete teams consisting of leading talents, experts and scholars, academic heads and young academic talents. They are working as the hospital mainstays in the clinical department, the teaching classrooms and the key laboratories. A number of talents with state-bestowed titles are shining like stars in the hospital. The hospital proudly possesses a faculty of 2,981. Among them, 541 are high-ranking experts and specialists. Additionally, a group of experts and scholars are entitled for special allowance by the State Council of China. And what's more, a group of prestigious professors, the former well-known professors of the military hospital, are still working in their posts for the hospital. Among all the hospitals in China, Nanfang Hospital is the first one to introduce lean management by establishing the Client Service Center and starting the use of Client's History real-time monitoring system, with which the hospital's medical service quality and efficiency under vigorous and innovative leadership have been enhanced to an unparalleled extent. As a result, the the hospital was awarded the first grade prize for patient history appraisal among the national first-class comprehensive hospitals, advanced hospital status by the 2005 to 2007 National Hospitals Administration, and given the title of National Exemplary Hospital. The hospital is in the first group of key hospitals for the National Quality Nursing Service Exemplary Project, approved by the Ministry of Health in China as well. Additionally, the hospital is the Guangdong Provincial Training Base for professional nurses. As it was remarked in the Analects of Confucius, a workman must sharpen his tools if he is to do his work well. In the introduction and purchase of medical instruments, Nanfang Hospital keeps standing at the forefront of medical advances and has initiated the first PET center in South China. It has purchased the first instrument for thermotherapy in Asia, the first set for magnetic resonance, and other advanced equipment of international standard, all of which have ensured the essential advances of medical systems. The hospital has initiated the establishment of Health Management Center among the national hospitals, aiming for a people-oriented, life-utmost approach. The centre has been approved as the National Health Management Exemplary Base. Nanfang Hospital used to be affiliated to the first military medical university and used to be a shining star in the military medical field. Since the handover to Guangdong Province in August 2004, the hospital has completed the critical evolution from battlefield to market field, and from the Great Transformation to the Great Leap. In clinical teaching, the hospital has taken the teaching loads of 4 sub-majors: clinical medicine, medical imaging, laboratory medicine and oral medicine. The faculty teaching 2,500 undergraduates, 1,000 postgraduates, 400 medical trainees and 100 clinical doctors for standardized training. In clinical teaching, the hospital has taken the teaching loads of 4 sub-majors: clinical medicine, medical imaging, laboratory medicine and oral medicine. The faculty teaching 2,500 undergraduates, 1,000 postgraduates, 400 medical trainees and 100 clinical doctors for standardized training. The hospital is one of the first approved institutions for the 8-year MD program and one of the first bases for specialist training approved by the Chinese Ministry of Health. In scientific research, Nanfang Hospital closely integrates scientific research with clinical application in the pursuit of clinical innovations. The medicine prescribed with Chinese herbs, Sanjiu Wei Tai and Zhengtian Wan pill, have benefited many patients. Under the intellectual property rights of the hospital, the acoustic contrast agent, the State Category 1 new drug, has been put into successful marketization. Working in the Department of Nephrology of the hospital, Professor Hou Fanfan, member of the Chinese Academy of Sciences, gained her worldwide fame in the discipline of nephrology for her research paper originating in mainland China and published in the New England Journal of Medicine for the first time across the mainland. In the field of scientific research, the hospital is the highest ranked medical institution in Guangdong Province. Research teams have been cooperating with a strong spirit of teamwork in medical explorations, cultivating the cutting edge of medical sciences and gaining many worthy achievements. Nanfang Hospital clearly adapts to the new circumstances since the transition from a military one to a civilian one. By looking into the medical service market from an entrepreneurial view and planning hospital development strategically, the hospital has proposed a development strategy of large-scale management of the hospital, developing the hospital in its distinctiveness and winning with its high quality of service. Under this slogan, the hospital actively keeps close to the market and earnestly cultivates and constructs specialist technologies, endeavouring to realise the aim of taking the initiative, being better when others are good, and being the best when others are better. The new technologies used by the faculty are flourishing. The diagnosis and treatment of chronic nephrology is taking the lead internationally, with a proof of titration using RAS inhibitor as an item of continuing medical education in America. So it is with the treatment of infothalassemia and malignant hematonosis with hematopoietic stem cell transplant. The surgical procedures applied to refractory tumours in the baseline of cranial base and neurospongioma are drawing great attention internationally. The assisted reproductive technology has entered domestically advanced ranks in terms of periodicity and success rate. The cases having undergone kidney transplants reached 4,000 in total. The survival rates of patients and kidneys taking the lead domestically. The cases of liver transplants are rising annually with a success rate of 96%, taking the lead nationally. Nanfang Hospital seeks medical ethics based on the notion of a people-oriented approach and is pursuing excellence based on the notion of management orientation. The generations of Nanfang Hospital faculty have been pushing the hospital construction to a higher level by succeeding and developing the best style of living plainly but struggling hard, uniting for progress and having the courage for innovation. Since the Reformation and opening up in China, the hospital has integrated the best traditions from the army with the innovative spirits from the Special Economic Zone, forming the unique hospital culture and management mode and constructing a team of full-time administrators who have become the backbone for better and faster development of the hospital. The Huiqiao Department, founded in 1979, fully represents Nanfang Hospital for the special zone spirits of taking initiatives to do things. The department is not only the pride of the hospital, but also the flag for reformation and opening up of the Chinese medical industry. The former Secretary General of the CPC Central Committee and the Chairman of the Central Military Committee of PLA, former President Yang Jiemin, praised and encouraged the department with the inscription, "Saving patients' lives, devoting selves unselfishly, struggling hard and holding faithfulness." A hospital is the emotional link between the government and the common people. The harmony in the physician-patient relationship manifests itself as the happiness and well-being of harmonious societies. In combating SARS in 2003, the faculty came together for the rescue and salvage of SARS patients, disregarding their own safety. The medical teams of Nanfang Hospital struggled day and night rescuing the wounded in Wenshuan, Sichuan Province in 2008 and Yushu, Qinghai Province in 2010. In Tibet and Nanshan, Nanfang Hospital sent their warmth and concerns to the civilians and army men by sending medical service. All these magnificent feats have invited praise and recognition from the leaders and common people. Nanfang Hospital was awarded the National Earthquake Relief Heroic Collective by the CPC Central Committee, the State Council and the Military Commission of the CPC Central Committee. The hospital leader, Secretary of the Hospital CPC Committee, was received by President Hu Jintao, Secretary General of the CPC Central Committee. Hospital culture is not only the soul of a hospital faculty, but also the ideological pillar and the internal drive that a hospital relies on for its own existence and development. Nanfang Hospital has experienced the baptism of military culture and special economic zone spirits, and has evolved its own cultural identity of strict execution of orders and prohibitions, faithful cooperation in combined operations, daring to take initiatives, and bravery to make innovations. The hospital CPC committee keeps attaching importance to the succession and development of cultural traditions of the hospital, all the time maintaining the philosophy of a people-oriented approach and focuses on the hospital's appeal to patients and the cohesive force to the faculty. The hospital does its best to ease and comfort the patients with specialist technology, high quality and good service. Meanwhile, the hospital keeps fortifying the faculty's sense of happiness by creating a satisfactory platform for vocational development and increasing the welfare and salaries for them. For many years, cultural development has enriched and developed the cultural heritage of the hospital, and recently Nanfang Hospital was appraised as the 2010 National Advanced Institution for Hospital Cultural Construction by the Chinese Hospital Association. Like a wise elder in people's minds, Nanfang Hospital is amiable, respectable and reliable. The respect and reliability stem from the hospital's humanist principles. The tradition of rigorous schooling, strong cultural foundation, innovative management mechanisms and the influence of the army's spirits all contribute to its high place in the Chinese medical industry. The glorious history of 70 years is a small-scale representation of the development of China's medical industry. Nanfang Hospital, like the Big Dipper shining in South China, will be standing at the forefront of reformation and opening up, leading the developments of the era.